sanitize my hands, and I have my mask on for preventative purposes due to COVID-19 pandemic. Hello, my name is Scott. I'm a student physical therapist here at UAMS. Today what I'm going to be doing is I'm going to be removing this old dressing, taking a few quick measurements and assessing your wound, and then replacing it with a new dressing. During this process, I will be shifting around a bit, but if you have any pain or discomfort during this, please let me know. Are you currently in any pain? No? Awesome. Please give me a quick second. I'll get my treatment area set up, and I'll be right back. I'm going to go ahead and designate this side as the dirty side, this side is the clean side. I'll put the pin on the clean side accordingly. I'm going to wash my hands. Breast spaces. Go ahead and place the towels on the treatment area. And as I stated before, this left side is the clean area, this side is the dirty side. So I'm going to go ahead and place everything on the clean side. Now I'm going to don my PPE, so I get my mask. gloves. So underneath the patient, I will be shifting you around a little bit. Please let me know if you have any discomfort. Good. Let's go ahead and cover up any treatment areas that we are not working with today. Keep the patient nice and warm. Good, so I'm going to go ahead and carefully peel the skin away from the tape and not the other way around. And remove the primary dressing. This would be plenty 2x2 gauze. And I know that there's minimal serous fluid exudate with no apparent odor coming from it. Dispose of that. First, gauze right the inside of the wound in circular fashion from the inside outwards. Make sure to get the undermining and the tunneling present. Make sure it's thoroughly dry and clean. I'm going to get another new gauze pad to make sure the peri wound and the wound edges are also thoroughly dried out and clean. Okay, tear some pieces of tape. This on the dirty side. Then I'm going to go ahead and don a second pair of gloves. Good, so now I'm going to go ahead and take some quick measurements. So looking at the wound depth, the deepest part of the wound, that is approximately 2.1, let's say 2.1 centimeters for wound depth. And I know that there's also undermining and tunneling present, assuming that way is 12, this way is 6. There's undermining present from 6 to 9, so at approximately 7:30, the deepest part of the wound, there is 1.7 centimeters of undermining present, and at 9:30 there's also tunneling. So getting a measurement of that, there's approximately 2.7 centimeters of tunneling. So I'll make sure my tech has all that written down. Awesome. Now the wound length looks to be the longest from 12 to 5. So measuring that comes out to be approximately 7.4 centimeters. And the widest part of the wound width, is approximately from 3 to 9, and that measures to be 6.4 centimeters. So I know, looking at the wound bed itself, that there's approximately 70% red granulation tissue, 20% of yellow slaw, 5% of exposed bone, and 5% of black eschar. Per wound looks intact and unremarkable, and the wound edges are attached except for the aforementioned tunneling and undermining. There's undermining from 6 to 9 and tunneling at approximately 9:30. Otherwise, wound edges look attached. So now that that's all measured, I'm going to go ahead and start packing the wound. Actually, no, I'm going to apply the prep. Make sure the wound stays protected. Then I'll start packing the wound. So first I'm going to start with the 4x4 to start getting the undermining and the tunneling, and also some of the wound bed. So as the first dressing is a 4x4, this is the second dressing, a 2x2. I'm gonna start just getting some of the wound bed, make sure that's nice and inside. The second 2x2 dressing, third dressing overall. Make sure I continue to get the wound nice and packed. I'm going to use a fourth 2x2 dressing. To cover up the remaining part of the wound bed and the eschar. Good. Now I'm going to use a 4x4 gauze pad as my secondary. Actually, let's go for that. I'm going to go ahead and secure it with tape. So now that that's all secure, we'll go ahead and initial and date it. All right, so now your wound looks to be clean. We've changed out the dressing and you're all good to go. For this, what we want you to do is we're gonna place you on something called a turning schedule, to where we want you to turn every 2 hours or so. So you can do this, or if you need to be reminded, we'll also remind your caregiver and your spouse of that, so that they can also assist with this task. This will just help to continue to promote healing by relieving pressure off of that wound that you have there. Also, if you notice any signs of redness, any changes in color, that may be a sign of infection, or if you notice a fever coming on, that may be also a sign of infection. If you notice that, please let one of us or healthcare staff or caregiver know, so that it can be addressed immediately. Do you have any questions for me at this point? No? Awesome. Are you currently in any pain? No? Good. So I'm gonna go ahead and get it cleaned up. So, thank you for your patience. Just gonna shift you around. I'm going to dispose of any items we did not use. So next I'm going to have my tech undo my gown. then I'm going to remove my glasses. And then I'd finally remove my mask. Clean this up. Place in a separate clean area to use. And then to finish off, I would wash my hands.